Hello.
Hi.
Hi, my name is Rosalia Gonzalez, and I'm a student nurse here at Cedar Crest College. And I'm here to work with you today. Is that okay?
Yeah.
Okay. Can I have your name and date of birth?
Henry Valentine, March 7th, 1968.
Is it okay if I sit here?
Mm-hmm.
All right. Thank you. I decided to come in real quick because I saw that they took your neighbor for a test. And so I'm going to close the curtain just in case he comes back. But I wanted to sit with you to talk about a teaching session that the doctor wanted me to go over with you.
Okay.
Have you ever heard of the medication Metapolo?
No.
How about, have you ever injected yourself with any other kind of medication?
Mm-mm.
Okay, so I see that you're deficient in knowledge with new drug therapy related to that. You're telling me that you don't have no prior understanding of it. So a long-term goal for you is that when you go home, that you'll be able to maintain your heart rate at a normal range and your blood pressure until 6 weeks when you come see the doctor. Okay? And so our short-term goal for you today is that before the session is over, I want you to go over 2 side effects that the medication gives you. I want you to verbalize that you have an understanding of the teaching of both medications. And I also want you to verbalize one adverse reaction that the medication Metapolo can give you. Okay?
Okay.
All right. So this medication is given for hypertension, tachycardia, and people that have had a heart attack. And so that's why you have it, because you had a heart attack and we put you on it. Want you to get better. The medication is called Metapolo, and that is the generic name. But if you go to the pharmacy and you pick it up, it'll be Lopressa. The doctor ordered 25 milligrams every day, once a day, okay, by mouth. So it's preferred you take it in the morning with food because it can give GI upset, and take it with a whole cup of water, okay? So this medication has a few side effects. Dizziness, it has hypotension, hypoglycemia, it has, it can give you mental change, depression, and erectile dysfunction. And I wanted to tell you the way the medicine works. So what it does is that it decreases the workload of your heart, and so it decreases your heart rate and your blood pressure, and so your body's demand for oxygen is decreased, and so your heart you feel better. So that's what the medicine does. Some of the things that we worry about with the medication is that it can give you hypoglycemia. So with that, your sugars can go down. So when you're home, we want you to be able to monitor your blood sugars closely, because you can become hypoglycemic and become lethargic. And you can, lose consciousness and fall. And since you live at home alone, that's a big concern. Another thing is that this can make you it can give you hypotension, so it can give you dizziness. And when you stand up or you move too quick, you might lose balance and fall. So we want you to be careful with that when you get up, you do it slowly. You don't just get up abruptly, because we don't want you to fall and get hurt. When you're, another thing is that this medication you cannot stop it when you start it. If you stop it abruptly, it can cause you to have a heart attack or fatal, it can become fatal. You can't double up on the medication, because if you double up on the medication, your heart rate and your blood pressure could drop, and that can be dangerous, okay? So do you have any questions so far about the medication? All right, so this medication you can't take, it has a perimeter, and that is that if your heart rate is at 60 or under, you cannot take the medication, okay? And if that happens 2 days in a row, then you need to call the doctor, because they need to fix your regimen, okay? So do you know how to take your heart rate?
No.
Okay, so I'm going to show you how to take your heart rate. Can you pull out your hand, please? So you're going to take your 2 fingers, and you're gonna bring it down across your thumb, and you're gonna feel like a little groove, a little groove, and you're gonna press down, and you're gonna feel like a pulse. You're gonna count that for 60 seconds, and that's gonna let you know your heart rate. So that's how you'll monitor and know when to take the medication and when not to take the medication. Also, we're gonna send you home with a prescription that's gonna be for blood pressure cuff. And so the blood pressure cuff, you're gonna put it on. There's a button. You touch it. It's gonna give you a top number and a bottom number. If your top number is less than 90, you don't take the medication, because that can cause hypertension, can cause you to drop. Okay? So those are the things we want you to monitor. When you're home, please make sure that you have non-skid socks on or slippers that are non-skid, and you walk with them so you won't fall. Make sure furniture is up against the wall for safety reasons. I know that you don't have your glasses here with you today, and that is important that you keep your glasses on when you take your medication, because we want you to take the right dose, at the right time, and the right medication with it, So, so that's really important. Do you have any questions for me?
No.
Can you tell me 2 side effects that this medication gives you?
Sure. Hypoglycemia and dizziness.
Yeah. And can you give me 1 adverse reaction?
Well, the heart rate can go too low.
Okay. So, do you understand the medication and everything I'm telling you and how to take it?
Yeah.
Okay. So we're going to move on to the injection. So I bought you a magnifying glass, and I bought you just the needles that we get with insulin. Okay. And I wanted to go over with you, so I know it'll be hard for you to see it on here, so I wanted you to be able to see it on the paper with your thing. So these little lines here, these each right here, they're 1 unit. Okay. So the doctor wants you to take 10 units of insulin, and he wants you to take it at noontime. So when you go to the pharmacy and pick up this medication, they might give it to you as insulin Glargine, or they will give it to you as Lantus. They're both the same thing. It's just Lantus is the trade name and insulin Glargine is the generic name to it. Okay? So I know the diabetic doctor went over you all that, but I'm just going to show you the injection part. Okay? So the first thing we need to always know is that this medication got to be taken out of the refrigerator 30 minutes before you take it. Make sure that it's clear and there's no particles in it. If it's cloudy and particles, you do not take it. Okay? You get rid of it. You do not take it. So this is the needle that we use, like I showed you on the paper. So I want you to go along with me as I teach you how to use the needle. Okay, so first thing is that I want you to know that you gotta wash your hands before you inject yourself with the medication. So for 20 seconds, you can use this hand sanitizer, or you can use the sink with soap, and you just wash your hands 20 seconds. So we put on gloves to administer the medication. Okay. And so we're going to clean off the vial on the rubber area. Make sure it's clean. And then we're going to take the needle and we're going to uncap it. And this is a 31 gauge and it's a half of a milliliter. But they come in different sizes. The pharmacist will give you the right one. Okay? Alright, so we're going to bring the plunger, which is the bottom part, down to 10. Exactly. So the air is going to go into your vial. So you're going to take it and you're going to put it in the vial. And you're going to hold the medication with your non-dominant hand, put it through the rubber, and then press the air in. Exactly. Then you're going to invert it and you're going to turn it upside down. And then you're going to pull it back down to 10. So that's the medication that you're going to take. Make sure there's no bubbles. If there's bubbles, you can tap it. Okay, and then you will put it back in and you will pull it back down to 10 so you can get the correct amount. Okay, but we don't have no bubbles. So you take it out and you're going to do what we call a scoop. So you put it into the cap without holding it with your other hand, and that's for it won't get contaminated. Okay. And you can put it up against something if you're having a hard time, okay? So this, we're gonna act like this is our skin where we're gonna inject, okay? We call it an injector pad. And so here's a swab for you. And so what I want you to do is that I want you to take out the alcohol and I want you to rub the skin around in a circular motion. And so this medication, you can take it in your abdomen 2 inches from the umbilical cord, or you can take it in your upper arms on the outer side, or your legs on the outer side, okay? And some people even on the buttocks if they have the help for that. But we always tell the patients to use the abdomen, okay? Because it's easier for them to inject themselves. So then you're going to take the needle and you're going to pinch the skin.
Like that?
And you're going to go in a 45-degree angle. And you're going to press the plunger and take the medication in. You're going to let go. Let it go. And for 5 to 10 seconds, then you bring it out. And then you're going to put it in a Sharpie. And so you can make this in your home. And you can make it out of a detergent bottle. And make sure that you put sharps for nobody will touch it. Make sure that it's covered. And when you get rid of it, you put tape around it. And you can take it to CVS or a hospital or wherever you're going to discard it. When you put your insulin, you make sure you use different sites. And that there's no redness, no warmth, or no bruising. Okay? Do you have any questions for me?
No.
I think you did an awesome job for your first time.
Thank you.
If you have any questions, you can call the office or you can call the pharmacist on the medication and we will be glad to help you.
Okay.
All right. You have a good day.
You too.
Thank you.